Hello, I'm Reihan Salam, and this is Getting It Right, a new podcast from National Review. I am joined today by Patrick Brennan, one of our editors here at National Review, and Callie Gable, our super intern. But before we start talking to Callie, I wanted to chat with Pat a little bit about the general congressional outlook, and specifically about how Obamacare is going to play into it. I think there's been a lot of confidence among conservatives that the unpopularity of Obamacare is going to have a very big impact on these midterm congressional elections. But does that sound right to you? Does that fit the facts as you understand them, Pat?
So last week, in the last edition of the podcast, we expressed some skepticism about whether enough bad headlines would keep coming, and reflected on the fact that that was something that Republicans had to some extent counted on. But there's an article in Bloomberg this week suggesting that Republican campaign strategists have rapidly been moving away from the issue, or not moving away perhaps, but moving it to sort of ordinary issue status rather than it being the issue. So some interesting numbers in there that in the North Carolina Senate race, where this guy Tom Tillis, Speaker of the House, is challenging Kay Hagan, 54% of the ads in April were on Obamacare. 3,000 out of 5,700 ads aired. It's a lot of ads. I'm glad I live in a solidly blue state. I don't have to deal with battlegrounds. But that dropped to 27% of ads were on Obamacare in July, and 72% of ads were on the economy or government spending. In Louisiana, April, 90%, or almost all of the ads in Louisiana that were on a specific issue were on Obamacare in the Louisiana Senate race. That's now dropped to 41% in July, and it's down to 23% of ads in Arkansas, where Tom Cotton is challenging Mark Pryor.
So assuming these political professionals know their business, they're clearly responding to something they're seeing in public opinion, right?
Yeah, I think that Obamacare was sort of this, when it seemed like this new sort of shocking thing, it sort of could be seen as the issue because there's a lot of change going on. But now that it's here to stay, I think we're just stuck with it. And so if people don't like it, even if people don't like it, it's just another government program that Republicans have a good case against, but it's just one of many.
You know, it turns out that we actually have a North Carolina resident with us. Callie, as a college student, do you actually ever see political ads? Do you see any political organizing on campus? Does that affect your life at all?
We definitely have a large contingency of political organizations on campus from across the spectrum, but as far as really being exposed to political ads or a lot of the candidates or a lot of the issues, I would say that in general, no. And I think that could partially be because I don't think a lot of college students watch TV, and we're more into the Netflix or the digital age, and so I don't think a lot of that type of campaigning reaches us.
There you have it, guys. Our youth correspondent tells you exactly what you had always expected. The young people are apathetic, and the country is going to the dogs. So basically, Obamacare is not going to be this huge game changer of an issue, it seems. Republicans are going to have to focus on a variety of other things, yada yada. But that doesn't mean that Obamacare is not going to be a really, really huge issue. Let's say Republicans do manage to win a majority in the Senate. That's going to introduce all kinds of complications. That's going to mean they're going to have to pass some kind of budget. They're going to be responsible for all kinds of stuff. And within the Republican caucus, both on the House side and the Senate side, they're going to kind of have to decide what they're going to do about Obamacare. Are they going to try to defund it again or whatever else? So it turns out that, there's been a lot of thinking about the next steps for Obamacare. Partly what are the next steps of the next couple of years, and then the next steps going forward. Pat, tell us a bit about some of the different ideas that have been thrown around recently about how conservatives and Republicans ought to approach Obamacare in, let's say, the next 2-3 years.
So certainly all of the legislative proposals that have been put out there so far start from the premise of you've got to repeal Obamacare. And one very cynical and critical way to look at them is basically to what degree do they replace it with something that is like Obamacare? Does it look dramatically different from Obamacare, or is it just sort of does it not resemble Obamacare at all, I suppose, which is what something like Bobby Jindal's plan does, which is basically just sort of send some money to states and says you've got to cover people with pre-existing conditions. So the thing is, a lot of them start with the same premises and goals of Obamacare, that we have to cover people with pre-existing conditions. coverage, universal coverage is not necessarily a goal, but they most of them try to some extent to cover people and obviously the premise of all of them is, or the goal of all of them is to reduce healthcare costs. Probably then what varies is the degree to which they're willing to regulate and spend and aggressively cut costs in order to raise coverage. And so Bobby Jindal's proposal, and then there's a proposal from the Republican Study Committee, tend not to emphasize universal coverage. And Jindal's proposal, which Ross Douthat had some sort of trenchant criticisms of a while ago, really doesn't actually aim to maintain Obamacare levels of coverage at all. The RSC, I think, predicts that they will get there, but that's not necessarily definite. And then there's a proposal among the Senate Republicans by Tom Coburn and
Richard Burr
and Orrin Hatch,
yeah.
that aims to reduce the deficit, but also would end up with higher coverage levels in Obamacare, I believe is the goal.
So one of the complications, I mean, it is interesting when you look at the RSC proposal and when you look at the Jindal proposal, in a lot of ways they bear a strong resemblance to the Bush proposal that was rolled out, I believe it was in 2007, and it was a proposal that in a way was very much a pre-Obamacare proposal. It was something that probably would have been an improvement over the status quo, but I think there are a lot of folks, including Burr, Coburn, and Hatch, who kind of think that, well, wait a second, the world looks different now. We're going to have to approach this issue differently, partly because we're now going to have to deal with the transition away from Obamacare. And I think that, on the other hand, the Coburn bill, and I think we can call it the Coburn bill because, frankly, he was the prime mover behind it.
In the standard taxonomy, it's Coburn care.
Yeah, Coburn and Hatch, I think, were the big movers behind it. Sorry, Richard Burr. But I think that, the thing about that is that it's been very vulnerable to the accusation of being Obamacare light, which is kind of what Pat brought up a second ago. This idea that, look, I mean, the more comprehensive you want it to be, the more you want it to deal with that pre-existing coverage problem, the more coverage expansion you want to get out of it. Unfortunately, and also the more you want to deal with that transition problem of moving from, the kind of Obamacare exchanges to some new system, the more you're going to get accused of being Obamacare light. Now, we know of one person, a friend of the agenda, who is not very concerned about the charge of being Obamacare light, and that is Ovik Roy, a very frequent contributor to National Review. And fortunately, she's not just a super intern, she is actually one of the greatest interns in history, Callie Gable, who's done very thorough work summarizing Ovik's plan and thinking through its implications. So, Callie, first of all, tell us, is Ovik's plan the kind of thing that's standard issue among Republicans? Do conservatives totally embrace the idea of just doing what Ovik wants to do, or is he coming out of left field here a bit?
I would say that in terms of the other Republican proposals or conservative proposals like Pat just kind of outlined for us, that Ovik's plan is really different because it not only increases coverage, but it, for instance, has a higher level of spending than does the Coburn Care or the Coburn Hatch Orrin plan. And I think that his plan also tackles kind of a political reality that the article you were discussing earlier also addresses, which is that at this point, as far as we are in the legislative implementation and even with public opinion, we can see that more people really prefer to reform Obamacare than to repeal it at this point. And it's still legislatively would be very difficult to repeal the law. So I think Ovik's plan really focuses on moving forward and reforming Obamacare in a way that is unusual for conservatives.
Well, that's certainly very, very controversial. Pat, tell us a little bit about that. Like, what are the barriers to just repealing Obamacare lock, stock, and barrel? If Republicans win the Senate with, 51 seats, and if they still have the House, why can't they just repeal it?
Well, until 2017, you have President Obama, and then you, unless you want to sort of cheat again, you have to get 60 votes in the Senate. And so Ovik's plan does not discard the idea of repeal. What he's saying is that I want to basically formulate a plan that can peel off. You say we end up with 51 senators, can peel off 9 Democrats. And he's not attempting to peel off Bernie Sanders, but there are obviously there, and I think that's a useful way to look at what will be a plan that is going to create a lasting majority, right? So Obamacare wasn't created to peel off Olympia Snowe or Scott Brown because and then they didn't need to. They just cheated and passed it with 53 votes or in the Senate or whatever.
You say cheating, but what you mean is reconciliation, right?
Well,
I mean,
yeah,
sort of
but
that's
treating
kind of
something that it is really not a budget bill as a budget bill. I mean, the Senate, you don't pass bills unless you have 60 votes.
Yeah, but I mean, if Obamacare is a law that has huge implications for the budget, right? I mean, there are big changes that conservatives can make through reconciliation.
It's not clear that you can repeal it via reconciliation. I actually remember discussing.
Yeah, that sounds
right.
right.
I can't remember, but whatever you classify it as, whether it's cheating or not. But I think that one important thing is that Ovik doesn't necessarily look at this as a compromise bill, also because you can refer to it as coming out of left field, but really I think he characterized it as coming out of right field, because what he wants to do is he says, look, like Obamacare actually has some market-oriented aspects to it. Fundamentally, of course, it's not a market-oriented plan. But there are market-oriented aspects of it, and those are the same market-oriented aspects that conservatives have wanted to apply to Medicaid and Medicare for a while. The idea of creating more markets for, more efficient markets for health insurance and encouraging high-deductible plans and that sort of thing. And so,
actually, I'm curious. I mean, Callie, can you tell us a bit about what exactly Ovik wants to do to the exchanges? I mean, there are a lot of other pieces to it, and I want to ask you about those too, but particularly with regard to the exchanges.
Okay, so as far as the exchanges, they actually wouldn't go anywhere. So something that's been pretty controversial recently with the How Big Challenge, and we're kind of wondering about what the future of exchanges would be, and Ovik's plan, exchanges would actually be here to stay. And what he would do is he would make the benchmark plan in the exchanges a plan that has a high deductible and then a subsidy from the government with a health savings account. So individuals would be able to use the health savings account for acute or every day going to the doctor types of expenses, and then they would still be covered should something catastrophic happen to them, and they could save over the money from the health savings account year to year, and so their plan would actually become more valuable. In addition to that,
got it. So that actually addresses one criticism, which is that what Ovik is trying to do is change Obamacare so that people can buy junk insurance. So in fact, through these contributions he's making to HSAs, he's maybe in some respect making it more generous. Is that?
It would become more generous over time if people became or tried to stay healthy. And that's another huge implication as we see Americans using more and more care. It can drive them to be more cost-conscious consumers of healthcare, which could have great implications for spending. So if you stay healthy and if you make good choices about the providers that you see and try to get a good deal, you can save that money for future costs from year to year, and that health savings account adds up and adds up and adds up.
Got it. So, but as we all know, when you're talking about Obamacare, I mean, people do tend to talk about the exchanges, but my understanding is that about half of the coverage expansion actually comes out of Medicaid. And, when there are a variety of proposals that conservatives have, put out there, the Bush administration put out there, but also you have, other people more recently, to reform Medicaid, which seems like a really, really big piece of the Obamacare story, right? I mean, it's a big part of the political controversy at the state level. Do you accept the Medicaid expansion or not? And, what are some of the ideas that, let's say, Jim Capretta and Yuval Levin have talked about with Medicaid expansion? I mean, they've talked about the idea. So the one idea that I hear a lot about is this idea of per capita caps. The idea that, you want to limit Medicaid spending, make it predictable from year to year, see to it that, okay, we're not necessarily going to give you a block grant, but we're going to say for, these different types of beneficiaries, we're going to have this amount, it's reliable. If the people who are eligible for Medicaid increases in your state, you'll get that. So that's kind of the idea of like, let's keep Medicaid around, but let's make it more predictable so that states have an incentive to kind of save money, use it more effectively. But Ovik actually has a totally different approach to Medicaid, right, Callie?
Yes, he does. So Ovik would really restructure the whole entire Medicaid program. And one of the biggest problems with Medicaid right now is that it's a state, federal, jointly funded program. And there's a lot of crossed wires, there's a lot of waste, and there's
a lot of like passing the buck, I guess.
Yeah, there's a lot of passing the buck that goes on between the state and federal government. So what Ovik would do is he would move all of the people who get acute care, which means the basic, preventative visits, basic things that you think of going to the doctor and the hospital. And he would, instead of having Medicaid, he would give them all subsidies to buy private insurance plans in the exchanges. And this would be the type of plan we just discussed that has the high deductible with the health savings account. And what we know about Medicaid is that it often has, well, there's evidence to show that it often has poor health outcomes. So these people would actually be getting better care in the private market than they would have been getting in Medicaid. For the other part of Medicaid, which covers people who are disabled and who need long-term care, they're maybe elderly, it pays for some nursing home care, he would transfer all of that responsibility to the states. And they would be responsible fiscally and in the sense of delivery of long-term care Medicaid.
What percent of it's a very big, so surprising. We think of Medicaid as this health insurance program for poor people, which is sort of what it is. But a lot of health insurance is taking care of people toward the end of life. And so, what percentage of Medicaid is long term care? I mean, and the disabled population, it's huge, right?
It's huge, yes. So the kind of, if you think of the three categories of who's covered by Medicaid, it's the disabled and old people, children, which is S-chip, and then adults with dependent children. And the children and adults with dependent children actually take up a very small amount of the spending, and the long-term care, the disabled people, actually absorb about 60% of Medicaid spending,
Wow.
while only making up, I want to say, around 10% of the beneficiaries. So they're really the most expensive group.
So a lot of that long-term care we're talking about, basically, what it ends up paying for is for people who can't afford nursing homes later in life, and other issues too. But in large part, it pays for poor people's nursing homes.
Pat, what do you think about the political dimension of that proposal? Now, there's a lot of controversy around Ovik's proposal. I personally find it very important, interesting, and useful for kind of thinking through the kind of longer term debate around Obamacare. But what I will say is that the Medicaid piece of it seems potentially very appealing, because there are a lot of people at the state level who are going to really like the idea of taking at least a big chunk of this burden off of their hands.
Yes, I think so. Although generally, even if Medicaid is an administrative burden for states, because HHS really doesn't let states run Medicaid how they want, there are all these strings attached. But state bureaucrats, I generally think of as people who like to run as many programs as possible, even if they aren't really allowed to run them how they want. Just sort of the more goodies that you get to hand out, the better. And that's one of the reasons why red states have been a little more, it's also a good deal. The Medicaid expansion is 90% paid for by the federal government, but it's been a very hard issue for Republicans to say no to. So I don't know. And then they're also in the issue, the way if you split these programs, there are states that will be sort of relative losers in this bargain. So I think that presents a problem, and I don't know. So I like the plan on its policy merits, the Medicaid part of Ovik's plan and the plan in general. But on its policy merits, it's good. But the politics, I'm not sure you also get a lot from getting. This is an extraordinarily cynical thing to say, but getting poor people better access to health care is not necessarily a huge political winner. It tends not to be something that people care about a lot. How often did you hear Medicaid come up in presidential debates? How often did it come up in the debate about Obamacare? Either way. Did Obama boast about expanding Medicaid even though it was giving access to health insurance?
That's a good point. I will say, however, that in the 2012 campaign, I personally think a really critical moment came when Bill Clinton addressed the Democratic National Convention in Charlotte. And throughout that campaign, there had been a lot of Democrats trying to make hay of the fact that Paul Ryan had proposed a Medicare reform. The problem is that Ryan's Medicare reform actually left aggregate Medicare spending pretty much untouched. The idea was, we're going to change the way this program works, but he was very careful to see to it that current retirees and near retirees are shielded from its effects. But then Bill Clinton, being a political genius, said, well, wait a second, look at what the Ryan budget does to Medicaid. And the reason why I think it resonated with at least some people, and again, I don't have chapter and verse, I can't cite polling data on this, but is that there are a lot of Americans whose elderly relatives rely on Medicaid for long-term care and what have you. So I see where you're coming from, but I kind of think that Medicaid is a bigger political issue than some of us tend to think. Now, I think where you are right is that in intra-Republican debates, I don't think that Medicaid is something that is particularly looked upon very warmly. Partly because, in a lot of states, the people who are part of your electoral constituency, if you're a Republican, are not generally people who are on Medicaid, whereas if you're a Democrat, those people are going to be your voters, or those people who are on the bubble, they're at the margin. They might be eligible if there's an expansion. So I think that, that definitely plays into it. So I think you're totally right about inter-Republican politics, but in terms of two-party politics, I think that it has some effect.
Yeah, and you make a good point, which goes right back to the important point that Callie was making about what share of Medicaid goes to long-term care, rather than it's not necessarily a health insurance program for poor people. It's a health insurance program for long-term care program, everything. It's a lot more than just that. So,
But one thing, I mean, so speaking of Medicare, I mean, Medicare is definitely a really, really, really central political issue. When you think about, Clinton back in '96, I mean, he kind of ran his reelection campaign on protecting, Medicare and Medicaid spending, and I think that it continues to resonate a lot. And one thing, Ovik's been getting a lot of flack for this idea that, his plan represents some big concession to the left or whatever else. But I actually think that his Medicare proposal is actually, pretty conservative. Callie, tell us a bit about what he plans to do with Medicare.
Well, Ovik, importantly, really tries to return Medicare to its original purpose. So when Medicare was originally enacted, I believe people were living about 70. That was the estimated, years of life. So if you got Medicare when you were 65, what the federal government was really subsidizing was your care in an extremely vulnerable, extremely expensive time of your life. Now we see people to be living much, much older, and medical technology advancing so far that they can get these very expensive treatments, and we're paying for treatments for people way, way, way farther into their lives. And so what Ovik proposes is increasing the Medicaid age by 4 months every year.
The Medicare age, right?
Yes,
Yeah,
I'm sorry.
No problem.
The Medicare age for 4 months every year eternally. So that would really preserve the coverage for anybody who's currently on Medicare, but eventually phase it out so that I can't do that quick math in my head about how long it would take for Medicare to really just not exist anymore. Meanwhile, he is going to enact some reforms that would make it much more attractive for employers to offer retiree healthcare benefits and also offer subsidies to people who are 65 now or 64 and don't make the 4-month cutoff, or they miss the age, to be able to buy insurance in the private market.
Got it. So, I mean, the key thing here, it seems, is that basically people who are already on the exchanges are going to stay on these exchanges for longer. They'll still have access to that private insurance market.
Yeah, and Ovik points out, I think this is correct, really, that is envisioning Paul Ryan's Medicare plan, of which, I think we're all fans and has really won over a lot of the right. I don't think there's not really a more conservative approach to Medicare out there right now than Paul Ryan's plan until we got Ovik's plan. I mean, that's what Ovik takes. Ryan has basically would create a Medicare exchange, which is a whole lot more conservative than having a single payer Medicare system, which is what we have now. And so Ovik would basically proposes a much less regulated, much more competitive exchange and without a public option. Ryan retains a public option, and Ovik would get rid of that.
Yeah, that is interesting. And also people who are, affluent, who earn a lot of income as retirees, I mean, they're going to not be eligible for subsidies. So, I mean, you're basically kind of having them graduate out of the system entirely. That is pretty interesting. There are a bunch of other health reform plans that seem to be on the horizon. For example, my understanding is that Paul Ryan and Senator Rubio are working on something together. And one thing that we've heard from a lot of critics of Obamacare, people who advocate repeal and replace, is this idea that we should have a universal tax credit. Right now you have a pretty generous tax subsidy for people who get their insurance through their employers, but for people who don't, you don't have that subsidy. Now, Obamacare creates that subsidy for some people, but it's actually not universal, right? I mean, it only goes up to, 400% of income. No, granted, that's covering a big chunk of the population, but you still have people who are outside of that. And also the idea, that has been advanced by people like Jim Capretta and Yuval Levin, is that you should have a flat tax subsidy for these people who are not getting insurance through their employers. Pat, what do you think about the politics of that idea of having a flat tax subsidy for people who don't get health insurance through their employer? Actually, I think some people are more radical. They say, let's get rid of the employer exclusion and have everybody get this flat subsidy.
Right, which would be, fairly disruptive. So a lot of the formal Republican plans envision maintaining the employer exclusion as it stands now, and Ovik does that as well, but then moves up the implementation of the Cadillac tax and then keeps the Cadillac tax, which effectively diminishes the value of the employer tax exclusion. I think that there's some appeal on the right to the idea that there would just be this universal. You look at it as an entitlement, but it's also you get rid of concerns about.
I will tell you that as someone who buys my own health insurance, I would welcome such a subsidy. But I don't normally let those things get in the way of my policy views.
You avoid, for instance, one of the concerns we heard a lot about this Obamacare with Obamacare this spring. The CBO found that it was going to reduce the labor supply by 1 million, the equivalent of 1.5 million jobs or something. And so you'd get rid of the concerns that as subsidies phase out, which Obamacare maintains, that what's in Obamacare, if you have a universal tax credit that doesn't cover or covers the cost of very minimal insurance, you don't have these marginal tax rates.
Pat,
and
talk us through that for a second. So basically what you're saying is that having these sliding scale subsidies that peter out as you earn more income is a disincentive to earning more money, right?
Yeah, so there's University of Chicago economist Casey Mulligan, who's done more work than anyone I can think of recently on the idea, just based on sort of marginal tax rates from transfer programs. And so he estimates that Obamacare really means you're raising the effective tax rate on people who are in the individual market, so not all workers, but people who are buying insurance on their own by 8 to 10 percentage points for people who are on the subsidy scale. So every dollar they earn, they lose 10 cents in Obamacare subsidies, which is a big problem. Of course, if you had a universal subsidy, that would also be a disincentive to work to some extent because you could afford health insurance. But the idea is you make if you're earning, Obamacare subsidies are very generous, and the idea of sort of Jim Capretta and Yuval Levin is you have a less generous plan that just covers catastrophic insurance. So, if you want to have a comprehensive healthcare plan, you need to have a job.
Yeah, you've got to pay for more than just what you're getting from the tax subsidy. Yeah, I mean that's an interesting aspect of this because I think that when you're thinking about the administrative complexities, when you're thinking about income verification, one of the issues with income verification is that, okay, we find out when you file your taxes how much we owe you, but what if I have an income shock during the year? Let's say I lose my job or, or I'm working fewer hours. Or in the other direction, when there's an income shock that's a negative income shock, it's pretty easy to see, oh yeah, sure, we'll have some procedure through which you can apply for a bigger subsidy. But then
all you have to prove is that we did one really bad podcast and then prove that to the federal government and say, look, this resulted in a very negative income shock to me.
Aha, but here's the other problem, Pat. What if you have a positive income shock? And what if, Pat performs so brilliantly on this podcast that Callie decides, she's going to kind of give him just kind of all of her, marbles. Then, the thing is that you're not going to report that to the IRS necessarily. That's another issue, right? So I kind of feel like another virtue of the universal tax subsidy is that, it's not as generous. It's also really goddamn expensive. That is another issue. Even if it's actually a cheaper subsidy, and I think for Republicans who kind of want to get us to a balanced budget, et cetera, just the sticker shock of having universal subsidy could be one reason why the Coburn bill, for example, only has subsidies going up to 300% of poverty.
Yeah, I think that is a problem. Now, there's space, I believe, in the Coburn bill and in Ovic's plan. I mean, both of them reduce the deficit substantially, so there is some sort of room for moving to a more universal subsidy in both of them if you wanted to. I think that's feasible.
So, okay, we're about to wrap up, but I do want to just raise a few points that I think people in the audience should understand. Now, earlier in this podcast, you might have heard a young lady, Callie Gable, just basically say that she wanted to unplug people's respirators. She just wanted to go into their hospitals, unplug them, and let the elderly die. And I just want to say that it's not the position of the Getting It Right podcast. Pat and I love the elderly. We feel very strongly that they should get high quality. No, I'm just kidding. Callie, thank you very much for joining us. Do you have any final thoughts about how this Obamacare landscape is changing and evolving, and about the politics of it, or?
I just want to mention one more thing that I think is really going to be an important, at least Republican conservative sticking point for Ovic's plan, which is that it does effectively and explicitly repeal the individual mandate. And he really does some interesting, important things in terms of insurance market reform that will make low-cost coverage available to young, healthy individuals and really obviates the need for the individual mandate. And I think that's going to be an important thing that we're going to hear a lot about coming up if OVIC's plan kind of gets some traction, which I certainly hope it does.
Pat, do you have any thoughts about that come from your natural ruthlessness? I mean, are there any other people that you want to deny adequate health coverage to, or anything like that?
Well, no, but jumping off of Callie's point, I mean, I think we've discussed this a good amount, that the individual mandate has in some part sort of proved it, well, not proved itself unnecessary, but has been sort of shown it's now affects such a small share of the population that that it's really doesn't seem like all that big of a part of Obamacare. I mean, the employer mandate, OVIC also gets rid of, and that even liberals, even Obamacare defenders agree that it's sort of pointlessly distortionary now, and I don't know if people ever come around to that on the individual mandate.
There is one little tiny thing about the employer mandate that's kind of clever. There is a way in which you can pay a smaller penalty, I believe, under the employer mandate if you offer your employees very low-cost plans that they like, that keep them from going on the exchanges. And I always thought that was a really clever idea because, the idea is that, hey, if you can cover your employees kind of very inexpensively, but they're not so dissatisfied, I always thought that was like an interesting thing that could actually spur some innovation. But, that's a whole separate question.
Yeah, which OVIC includes. OVIC does kind of wants to spur innovation in the employer health market sector as well by letting smaller employers band together. And there's really not, there are examples of that, but as I take it, there's not a huge amount of innovation in that sector now. And so there should be ways, for employers to offer low cost and relatively spare insurance plans, but insurance that covers catastrophic costs at a low cost to their employees.
Yeah, I mean, I think that's a great point. I think that the one note that I'd want to end on, and this is where I part company with some folks, some of the criticisms of OVIC's plan, including criticism from Phil Klein, tremendously bright columnist for the Washington Examiner, is that, why bother with coverage expansion, period? I mean, that shouldn't be a priority. And if you had a plan that didn't emphasize coverage expansion, you would have something that's that winds up being a lot cheaper than OVIC's plan. And I guess what I would say is that I personally think that conservatives do need to accept that the debate has changed post-Obamacare. And also that coverage expansion is something that didn't start with Obamacare. There was a lot of public sector coverage expansion that happened through the Bush years. Medicaid rolls expanded quite a lot during the Bush years, and that was something that Republicans and Democrats went along with at the federal level and at the state level. So my thing is that coverage expansion is going to happen. That's going to be a political pressure that's out there. And I think that the smart way to respond to that is, well, let's see to it that the insurance that we're expanding access to is actual insurance. You know what I mean? And insurance that actually facilitates rather than inhibits innovation. That seems to me to be a pretty important point. Am I a crazy communist, Pat? Is that a...
No, I think you're right. And the sort of the best thing about Obamacare is, about Obamacare. There's nothing good about Obamacare. The best thing about Obamacare, or you don't need to rank the good things about Obamacare. They can all fit in bullet points. About Obamacare is that Obamacare, the idea is you kind of want to expand proper insurance to new customers, but also that you want to move existing people who are in single-payer Medicaid and Medicare systems into actual insurance. So it's expanding proper insurance to people who already have coverage as well.
There's nothing I hate more than people agreeing with each other. So, Callie, I know this is going to be difficult for you, but can you play devil's advocate for us? I mean, where are Pat and I going wrong? Like, could it be that actually conceding to the need for coverage expansion is in itself a bad thing?
Well, I think you just have to decide in many ways what type of a society you're going to live in moving forward. And we know that this is something that's going to be expensive. We know that it's something that's going to be very politically complicated. And so as far as reasons why we shouldn't is that I guess maybe you just don't think that it's a good investment, and you think that the Medicaid care that people are getting currently is adequate, or you think that people need to be more responsible for their own health care, or there are other underlying issues. There are a lot of reasons why you could say that this isn't a good government policy, but ultimately and I know I'm supposed to disagree, but I kind of agree with your sentiment, which is that we realize this is something that we're going to do, so how can we do it effectively and in a cost-effective way that gets people good care?
Okay, well, I will play devil's advocate against myself now. The person you were hearing before is soft-hearted Reihan. And hard-hearted Reihan says this: it's actually a pretty big problem that our public sector invests so much money in medical care, period. There are a ton of people who, if you said to them, what would you do with a marginal dollar, that the public sector should spend? And they would say, you know what? Give poor people cash or something like that. Give them some other resource that they could use that would actually help, kind of ease their burdens in all kinds of ways. It's not necessarily going to be medical care. And I've got to say, Callie is in tight cahoots with the medical care racket. And I think that's why she wants us to spend all of our money on medicine. And that's why I don't trust her, and you shouldn't either. Pat, any last words?
No.
Any last words?
Well, I think you raised a fair point, but and we could also just look at our economy generally. We already perhaps, that's the constant issue is, healthcare costs are so high. Well, it's not just the costs are high. It's also just that we do a lot of procedures, and so we spend a lot of time thinking about healthcare. And obviously, the more you involve the public sector in it, which to some extent, a coverage expansion will involve deregulating and privatizing. That's what Obamacare is about. But anything, if you expand more people's access to somehow subsidizing anything, even if the subsidies are light and encourage innovation, you will tend to get more of it. And I guess it's a question of whether we want that as a society.
Thanks very much for joining us, you guys. This is only our second podcast, but we are going to have many, many more. And I think what we might do in the future is literally just debate ourselves. I think that would actually be quite a lot of fun. But thanks for listening. And if you have any feedback, do let us know. We will talk to you next week.